Hello, I'm Dr. Queen Aditya, Senior Consultant Gynecologist from Kolkata. Today we are going to touch upon a subject which seldom is spoken about. That is MTP or Medical Termination of Pregnancy. Now, I think many of us are aware that medical termination of pregnancy or legal abortion was not even allowed in this country earlier. Only in 1971 the MTP Act was passed, and since then it has been legalized. And so many women have benefited from it, those who were genuinely in need of a termination. But there were certain limitations which very aptly have been corrected by the Amendment Act of 2021. The Act of 1971 got amended in 2021, and this new MTP Amendment Act looks into the deficiencies that were there in the previous one. So now the main reason why anyone will look for an abortion is failure of contraception, and that applies in the current act, that applies to all women up to 20 weeks of pregnancy. But the major concern is when there is a congenital malformation. Congenital malformations can get detected earlier with the advance of so many kinds of investigations. We all know that at around 12 to 13 weeks nowadays we do an NT scan, that is the nuchal translucency scan. Along with that, a blood test is done called dual marker. These two combined often give us a hint that is there might be a problem, and so many pregnancies get terminated beyond 12 weeks when these defects are found. Now, most of the defects, as we all know, are detected in the anomaly scan, which is roughly done between 19 and 22 weeks. And if a major congenital malformation is found, then that also warrants a termination. And in certain cases where a dual marker was missed earlier, a quadruple marker, which is a blood test, can be done later between 16 and 20 weeks. That also, if there is a problem, that also marks towards a congenital malformation, mostly chromosomal anomalies like Down syndrome, Edwards syndrome, and so on. And these warrant a termination. So this termination earlier by the 1971 Act was allowed only till 20 weeks, and if the defect is detected at 21 or 22 weeks, then there was no legal way by which a lady could seek abortion. So now with the amendment of the Act, medical termination of pregnancy is allowed up to 24 weeks in cases of congenital malformations, and also in certain other cases like rape victim, minor, differently abled or mentally challenged woman, change of marital status. These are a few indications where it can be done till 24 weeks. Now, some malformations get detected at 20 to 23 weeks. Fetal echo is usually done between 23 and 24 weeks to see the condition of the heart. And if there is a major defect, then earlier there was a total lack of any kind of facility. But the current MTP Amendment Act allows for termination beyond 24 weeks also in case of major congenital anomalies only, where every state has a medical board, and this board will decide whether a termination is required, because if the condition of the baby is incompatible with life, in that case even beyond 24 weeks termination can be done. So the current MTP Act Amendment 2021 allows for terminations up to 20 weeks without any hassle, between 20 and 24 weeks in special cases, which includes the congenital malformations, and beyond 24 weeks with the help of the medical board, again only in cases of congenital malformations. And to help us detect these malformations, we have several tests, various ultrasounds, echocardiography of the child, fetal echo, and the blood test, also another test called NIPT, and that is non-invasive prenatal testing, which also helps us and gives us a good idea that yes, there is a congenital malformation, there can be chromosomal anomalies. So with the dual marker, the quadruple marker, NIPT, and the various ultrasounds and fetal echo that are available, we can now detect congenital malformations. We all pray that every woman has a normal pregnancy and with the outcome of a healthy baby, but in case there is a problem of this kind, the MTP Act, that is 2021 amendment, helps us, and with the help of these tests we can all have a better life. Thank you so much.